No, we're just going to go to the next person. Okay, you guys ready? Sounds good. First, thank you so much for being here this morning. We're very grateful. I want to thank all the members of both parties who are here. I especially want to thank Jen Higgins, who's been a phenomenal partner helping lead us, and thank you so much, Jen. In the last month, families have seen their health insurance premiums surge as they've shopped for insurance during open enrollment because enhanced premium tax credits are set to expire, as we all know, at the end of the year. In fact, because of this, for millions of families on the ACA, their health premiums will rise an average of 26% next year. In Jersey, where we live, it could be even rougher with a 175% increase. That's $20,000 for a family of four. And that's why we're all here together, to try to solve this problem, do something about it, and avoid a massive new tax on hardworking families. So this bipartisan group came together, has been working for weeks, and I know Jen and I are very grateful for everybody's incredible leadership and all the time they've put in, talking not just to each other, but with the groups of senators, and putting aside the BS and delivering real solutions for people. Lots of Zooms and lots of calls, and we finally produced something called Common Ground 2025. You'll see it in the giant easel over there. It's backed by 35 House Democrats and Republicans, and will actually help make health care more affordable for American families. For us, this is all about working together to find common ground for the American people and to make life more affordable for them. The framework includes an extension of health insurance premium savings for American families with targeted modifications to help ensure families can still get the help they need. I think you all have copies of it, of the plan. If you don't, we'll make sure, just raise your hand, we'll make sure you get one. It's paid for and takes steps to ensure we root out fraud. We're calling for a vote by December 18th in both chambers of Congress to get something done before premiums rise in January. As part of our plan, we'll also work together on a menu of longer-term reforms to help families continue to save on their premiums. Having access to health care can literally mean the difference, as you know, between life and death. The House and Senate must work together to see this through. Time is ticking. Time's not on our side, but we know that if we work together, and we'll sit down with anybody, the president, our leadership, anybody you want, we'll sit down with to get something done. Because if we work together and lower costs, we know that our families' lives will be better, they'll be healthier, and we'll deliver for the country, and our best days will be ahead. Now, I'm going to turn it over to Jen, and thank you so much. Thanks. Thanks, Jen.
Thank you. Well, good morning to all of you. Thank you for taking time to be with us, and a special thank you to my colleagues who we share the stage with today. I'm Congresswoman Jen Higgins, and I proudly represent Virginia's 2nd Congressional District. What you see before you are a bipartisan group of congressmen and women who have come together to find a solution to a problem that all Americans care about, health care. We did what we said we would do after the 43-day government shutdown. We came together to discuss health care reform and the looming expiration of ACA enhanced premium tax credits. The group on this stage is sincere in our desire to ensure Americans have affordable health care coverage. As a geriatric nurse practitioner, co-chair of the Nursing Caucus, and one of the 2 nurse practitioners in Congress, it's an issue that I personally and professionally care about, and is why I'm here with my colleagues to impress upon our Republican and Democrat House and Senate leadership that we can find bipartisan solutions to provide affordable health care for the people who need it the most. Although we may have different opinions over the long-term solutions for reforming marketplace health care, or if there are even better and cheaper options for publicly available health insurance, we agree on the many aspects of the short-term solutions and are here today to share those with all of you. Although many bills have appeared to offer similar ideas, we wanted to propose more of a bipartisan framework to make it clear to the House and Senate leadership that defined ideas do exist, but that both sides of the aisle support. And you'll see on our letter that we have 15 Republicans and 20 Democrats, and I'm sure we could find more when we try harder. We stand here today facing an end-of-the-year expiration of the enhanced premium tax credits already in place, and recognize that the clock is ticking and the deadline is looming, and that implementing effective solutions will take time. The ACA is what is before us. I have 40,000 people in my district who rely on this health care, and doing nothing to prevent a spike in their premiums is wrong, especially after all the positive work we've tried to do with Working Families Tax Plan to address everyday affordability issues. With this deadline in front of us, we have broken the bipartisan framework we present today into 2 necessary steps and conveniently a 2-year process. And you have your page in front of you, so I'll spare all the details, but just know in summary, year 1 or step 1 is extension of the ACA enhanced premium tax credits, including things like income caps, some guardrails for waste, fraud, and abuse issues, PBM reform, Year 2, or step 2, would be continued reforms as agreed upon in the House and Senate by this summer, which would be before the midterm election season, including some options like physician fee schedule increases, hospital billing transparency, elimination of $0 premiums with provisions for need-based hardship support, implementation of HSA accounts based on the Cassidy bill, which would eventually eliminate the need, hopefully, for premium tax credits, and including the Give Kids a Chance Act to accelerate pediatric cancer treatments and expand access to life-saving therapies for children battling rare diseases. In closing, I offer the Oxford Language Dictionary of Compromise, an agreement or settlement of a dispute that is reached by each side making concessions. It's a word that we don't use often in the halls of Congress, but it's something the American people are craving and anxiously waiting for us to demonstrate that we understand and aren't afraid to use as a tool to get things done for them, the people we represent and serve. Lastly, thank you to my colleagues who have agreed to work on an issue near and dear to my heart, and I look forward to continuing to work together to ensure all Americans have the health care they deserve and can afford. Thank you very much, and with that, I'd like Susie Lee to come speak.
All right, thank you. Thank you, Jen. All right, good morning, everyone. It's great to be here. I just want to say two things. First of all, with the tax credits expiring, healthcare is going to become unaffordable for millions of Americans. And they're going to make the risky choice that my parents had to make when my father lost his job when he was 58. They had pre-existing conditions. It was before the ACA. And they made the decision to not have health insurance. They just couldn't afford it. There are going to be many senior couples, age 60, who are going to see their health insurance go up to $33,000. It's just not sustainable. They're going to make the risky decision to go without health insurance, and that means we're all going to pay higher premiums. These premium tax credits have worked to make health care affordable for millions of Americans. We know that there are reforms that need to be made, and that's what this group is about. It's basically us deciding that we're going to come together, we're going to work. It's not a red issue, it's not a blue issue. It's an issue about making sure people have access to health care. And that's why I'm so proud to stand with all these members who are really committed to finding a solution. Not everyone's going to like our framework, but it is something that we're committed to make sure that we work together, because preserving affordable health care is important to each and every one of our constituents. Thank you. Oh, where am I going? Juan Siscomani is next.
Good morning, everyone. Thank you for being here, and welcome to our message here this morning. I want to thank my colleagues for being here, and Representative Gottheimer and Kiggins for leading the charge on this. Rising costs across the board have already put pressure on Americans all across the country, and these premiums increases will only worsen the issue for so many Americans. The reality is that we're now facing a critical timeline where people, through no fault of their own, will pay the consequences if policymakers do not act. We could sit here and argue about how we got here, but that's not for today. That's for another day. That right now, it's our responsibility to act. Doing nothing is not an option in the circumstances. This is a short-term way to address this emergency, and there's longer-term policy that on the reform that we're going to work on later, but I'm committed to doing the work today. This period, right now, this proposal calls for action for both chambers to engage with House members ahead of a potential December vote. It also urges members ahead of this discussion and urges everyone on the group's consideration of the Common Ground 2025, the bipartisan health care framework that was described by my colleagues before me, and you can see on the chart as well. So our effort is a practical and bipartisan way to improve the lives of our constituents, lowering cost, increasing accountability, and providing the certainty that families need and they also deserve. The time to act is now, and that's what we're here to do. Thank you. And with that, I would like to introduce my colleague, Congresswoman Schultz. Thank you.
Thanks, Juan. Good morning. I'm Congresswoman Hillary Skolton, proudly representing Michigan's 3rd Congressional District in Congress. As a mom of 2 school-aged kids, working family, I can tell you firsthand the affordability crisis is crippling the American dream, and we have to act. Healthcare costs are the #1 issue that American families are struggling with every single day. Prior to the passage of the Affordable Care act, healthcare costs were the leading cause of personal bankruptcy in the United States of America. We have just 27 days until these health insurance premiums expire. 9 session days. Time is not on our side. We have to act. This is not just a Republican or a Democratic issue. This is an American issue. New polling out today shows that the vast majority of Americans want us to act to extend the Affordable Care Act tax credits, including 95% of Democrats, 84% of independents, and even 72% of Republicans. This is a deeply bipartisan issue. And if we fail to act, health insurance premiums will rise by close to double for many people across the country. For so many people, that means that they'll be forced to choose to go without health insurance, disproportionately impacting small business owners, young people who have aged out of their parents' insurance, and older Americans who have retired but are not yet eligible for Medicare. The time to act is now. I'm so proud to join this group of bipartisan lawmakers coming up with solutions. Thank you all for joining us today. With that, I'd like to invite Monica de la Cruz up to the podium to speak. Thank you.
Good morning. My name is Monica de la Cruz, and I have the honor of representing Deep South Texas, where the median income is just over $50,000. Many people in my district rely on these credits. We must address the rising cost to healthcare, and that's why I am glad to be working alongside members of both sides of the aisle to put together and put forward common sense, responsible policies that will lower healthcare costs and give families options. As my colleague said, this is not a red issue or a blue issue. This is a red, white, and blue issue. It is an American policy that affects everybody in our nation. We are urging leadership to consider our plan for a 2-year extension of the health insurance premium savings to lower costs for patients. I'm looking forward to continuing the discussion with both the House and Senate leadership. Thank you.
Don't worry about it.
Sorry.
No worries at all. Hi, I'm Sam Liccardo. I am honored to come before you at a time when we know just 28 days from now, 22 million Americans are going to see their health premiums more than double. We need to make America affordable again. I am grateful to this bipartisan coalition for coming together to put forward a very good plan. There are many good ideas out there. I was proud to join 5 Republicans and 5 Democrats in putting forward the Let's Get It Done Act, very similar provisions. That particular bill includes provisions that will actually pay for the extensions, which I also think is very important through savings and Medicare Advantage. We have a lot of good ideas out there. The important thing is that we get the Senate moving in a bipartisan way, as we see here in the House. And I'm grateful for the leadership, certainly of Josh and Jen, in pushing us together and forward. With that, I would like to introduce Congressman Jeff Van Drew. Oh, there we go. Thank you.
Good morning, everybody. It's good to be with you. I want to thank Josh and Jen as well. We all worked on it, but they did the lion's share of work, and it's not easy dealing with a bunch of Republicans and Democrats together, so I appreciate them. It isn't. Let's face it, it's the truth. I'm a very blunt person, so some of you are probably surprised to see me here. I am conservative. I am a Republican. I have certain values and beliefs. But I have to tell you what I believe in as well. And it's based upon my interaction with lots of people, not only in my district, but around the country. This truly is an issue that affects all Americans, American families, American patients, and we don't want them to suffer. And we have a responsibility. You know, the American people that live in our respective districts, they didn't create this problem. In all honesty, politicians created this problem. Now, I'm going to be blunt again. I do not like the Affordable Care Act. I don't. And it's fraught with all kinds of problems. There's a lot of corruption, and I think you're going to hear more about that in the upcoming hearings, including the committee that I chair. But that's not the point today, and that's not the discussion for today. So there's a couple takeaways in my mind out of this. Yes, we do have to change the ACA and the ACA tax credits. Insurance and the cost of it, it's been a great boon for insurance companies, and it's helped certain agents, some of whom are not even legal and appropriate, and certain brokers. It hasn't been good. But ladies and gentlemen, we have a responsibility. And right now, in the short term, people deserve to have their insurance. They must keep some form of insurance that is about equal to what they have so that they can continue to work, continue to raise their families, continue to live. This is a really important thing. So I believe that we have two responsibilities. One, to have a bridge for the American people. This bridge would allow them to keep their health insurance. I think the second responsibility we have is to do much, much better with health care. So what this enables, this is a good bill. And this is a good bill, and there are other good bills. And what these bills enable us to do is to work on, I hope to God we really do it. Quite frankly, I wish we didn't have, 43 days off. We could have worked on health care that entire time, but here we are. So it should give us the time to produce a plan that maybe, hopefully, most of us can agree on, but to produce a plan that's more responsible than the ACA and the ACA tax credits. That is better. That's our one responsibility. The second responsibility, as we do that, we need to ensure that American men, women, and children have uninterrupted care. We have to be humane and human about this as well. And this is tricky business, but this was a good start. I appreciate being invited. I appreciate being a little part of it. And I think that we can accomplish this goal. The time is short. We need to act fast, and I'll finally wrap up with this. I hope this plan is the one, but whatever it is, I'm willing to work with whomever to make sure the American people get what they deserve, which is decent health care. Thank you, and with that, next is Congressman Goodlander.
Good morning, everyone. Maggie Goodlander. Great shoes. Hope you all get to see those boots.
My Texas friends got me into it, I'm sorry.
Okay. I like them.
She gets an extra couple minutes here, you know?
Maggie Goodlander from New Hampshire. I'm really grateful to be here today with colleagues from across America to address a core problem that should bring every American together. No American should go without the health care they need, when they need it, and where they need it. We've come together to find common ground to address a genuine in the short term, a genuine crisis for millions of Americans, tens of thousands of people across my state. This isn't a line item, this is a lifeline. And what we've also done is come together to find common ground to fix the deep structural problems with our healthcare system. We're the richest country in the history of the world. We can solve this problem together, and I'm grateful to be here alongside all of my colleagues in doing just that. So with that, Nick Loloda, there you are.
Morning, everybody. It's not often that you see what you see here today. Republicans and Democrats working together on a real issue. And the facts on this are sobering. That since the signing of Obamacare, 1 in 3 claims are denied. Insurance premiums have risen 60% faster than inflation, and the insurance companies are making a gazillion dollars along the way. And there's another issue with these premium tax credits expiring at the end of the year. And they were called just a few years ago temporary and pandemic related, but if they expire, those insurance premiums are going to spike even more. So Republicans and Democrats from across the country are getting together today to figure out how we can work together on a pragmatic solution that can get 60 votes in the Senate and be signed by the President of the United States. A plan centered around lowering health care costs and ensuring accountability for insurance companies, a key component with how we should apply reforms to this issue that is plaguing a lot of Americans' affordabilities, including mine on Long Island. Awesome leadership by Jen Kiggins and Josh Gottheimer, who have done the lion's share of this work. They've really leaned into this, and I appreciate their leadership and the work of my colleagues behind me. I'm hopeful that we'll get something done before the end of the year. Our leaderships, neither Democrat nor Republican, have put forth a plan that can earn 60 votes in the Senate. So we're working together across the aisle to ensure that we present something worthy of the American people's attention. Thanks so much. And Greg Glansman of Ohio is next.
Good morning, everyone. You know, as Nick mentioned, and I think this is really important, we haven't seen a plan from leadership on either side that would get 60 votes or, you know, the votes necessary in the House. And there are a lot of political reasons for that. The only thing that matters to this group is the 22 million Americans who are about to see their health care costs skyrocket. And we came together with Jen and Josh's leadership to put together this plan that would, I believe, have the votes. I've always said that the largest majority in the House and the Senate is a bipartisan majority. You put this thing on the floor, it gets over 300 votes. It gets over 60 votes in the Senate. So we need, over the next couple of weeks, folks to jump in, to join us, to get this done, get it on the floor, and get us a vote so that we can protect people's health care. Thank you. All right.
Okay, well, wonderful, thank you. Thanks to all of you and to the news media for being present and carrying the message. And I think that, well, my name is Maria Salazar. I represent District Number 27 in the state of Florida. My district, out of the 435 in the country, is the 5th most impacted. I have more than 230,000 business owners, seniors, young Americans who will not be able to afford their health care by the end of the year. I think that the message that we want to send to all of you, to the media and to the average American people, is that we can work together. That Congress is not the chaos that sometimes you see when it comes to other policies. That we do know and we hear what you guys need, the average American, regardless whether we're Republicans or Democrats. We are here and we're fighting, and we are going to put something together by the end of the year. Let's hope leadership on both houses will help us, but we are doing the work together, Republicans and Democrats, and hearing what you need, which 22 million Americans, and in District 27, 230,000, 1/3 of my district will be affected, along with the rest of the constituents in the districts that my colleagues represent. So the message is, we're here, we're working, we have not forgotten you, and we're gonna get something done. And thanks to Josh and to Jen for putting together, that is democracy at its best. Thank you.
Great job.
She wanted to end it.
Okay, sorry, okay. Adam. Yeah, Adam Gray.
Good morning, Adam Gray from California. I represent the San Joaquin Valley, a rural part of California, not the part most people often think about, but the greatest and most productive agricultural valley in the entire world. And the people there deserve a government that works for them. And sitting here in my, I guess, 11th month in Congress, there's far too much partisan BS here, partisan blowhards, people unwilling to work together. And I just want to, in a heartfelt way, thank my colleagues for having the political courage, which of course is not accusing the other political party of something, but rather stepping up and challenging your own to come to the table and bring a bipartisan solution that actually makes people's lives better. Healthcare continues to become more expensive and less available. That's wrong. That's a problem we need to address. It's a problem the folks on this stage are committed to addressing. I'm proud to stand with them, and I'm ready to work to compromise and endorse something to at least stem the rising costs, hopefully go beyond that, and continue to improve health care for every American in every community across this country. Thank you. And now, Congressman Jeff Hurd.
Thank you all, and good morning. Jeff Hurd from Colorado's 3rd District. It doesn't matter if your district is red or blue or purple, the cost of health care and the health care premium cliff is an issue. One thing we're talking about is the unity of Republicans and Democrats that are on this dais today to talk about this issue. I would also say there's another unity here that no one has mentioned yet, which is rural and urban. My district is basically half of Colorado, and it's a very large district. It's very rural, and I have colleagues up here that are from smaller districts, more urban districts. This is another common issue that we have in rural America, in urban America. We're looking at addressing this the premium cliff, also with the enhanced premium tax credits, reforming them, extending them temporarily, but more fundamentally looking at the healthcare cost drivers. And the people that are going to do that are people up here on the stage from the Republican side, from the Democratic side, but also from urban America and from rural America, and I'm proud to be a part of that group. Thank you all. Next is Representative Case. Greg. Or Ed, sorry, Ed. Ed has disappeared, okay. Ed, okay. Congressman Case from the state of Hawaii.
He's on Hawaiian time.
I was heading for the plane to go home. Aloha to everybody. My colleagues have spoken at length and in great detail and with great authority about the details of our proposal, but I want to put it in a broader context. The question in front of us is Congress going to work or not? Is Congress going to work for the American people in a way that it should, to bring together competing viewpoints, to forge a solution that, as was mentioned, is a compromise, and deliver on a need for the American people? This is the question that is in front of us right now. And this is a very, very important part of that question. And we propose that Congress work. But we also propose that by putting together this group and by advocating for this framework, that we prove that Congress can also work in other areas that are critical to our country. And we are asking our colleagues, our leadership, also to join us in making Congress work, because the politics of 100% in a divided country, in a divided Congress, where anything that is passed has to pass at the end of the day with some kind of a bipartisan consensus, is the politics of reality today. This is what we're trying to bring to the table with this framework, but we hope that it grows beyond this framework into true muscle memory in Congress to take on the other challenges of our time. Mahalo. Let's see, we have Ryan McKenzie next.
Good morning. I'm Congressman Ryan McKenzie from Pennsylvania's 7th Congressional District in the Lehigh Valley and the Poconos. And we all come together in recognition of the fact that for millions of America, our healthcare system is broken and unaffordable. So we offer a real solution, a real path forward in a bipartisan way today that we can make sure that affordability and coverage continues for those most in need. We have a common sense framework in Common Ground 2025 that will help prevent spikes in insurance premiums, improve transparency, reduce waste and fraud in the healthcare system, and in a bipartisan way, offer a long-term and enduring path forward. Not just a short-term solution, which is part of this plan, but also long-term ideas, which with bipartisan support will have longevity in statute. As I said, in town halls, interviews, and communications to House and Senate leadership over the past number of months, I support extending the ACA tax credits with common sense reforms. We also need to make sure that we do that in a bipartisan way, because for those that are going to be continuing to receive those credits, we want to make sure we find that as appropriate and responsible middle ground that can continue that program. This bipartisan group has done that. We've come together through meetings, as you've heard, and actually sat down and negotiated these key elements of this framework, and we can offer real solutions for workers, families, seniors, and so many others with this common sense solution. Now, we're open, as was said, to discussions and conversations about how we can make this plan even better. And that is something that also comes with a bipartisan approach and group like this, is that we have that willingness and flexibility to work across the aisle in a bipartisan, bicameral way to make sure that ultimately we achieve something at the end of the day for the American people. I know that we can do that, and these positive changes can continue for the American people if we continue to work together. It's something I've done throughout my entire career, and I'm proud to stand with all of these legislators as we work together in a bipartisan way to find common ground. Thank you. Henry Quick.
Henry.
Good morning, Henry Quire from South Texas, and I also want to start off by thanking Josh and Jen for their leadership and our bipartisan folks that put the country before party in coming up with this solution. Look, my father and my mother, Martina and Odilia Cuellar, were migrant workers. They knew only a few words in English. They only went to a few grades, first and third grade. They worked very hard in the fields, in las piscas. They worked very, very, very hard But you know, even no matter how many hours they put in, they just didn't have the money with 8 kids, I'm the oldest of 8 kids, to afford health care. And that tells you a lot. I mean, I saw that firsthand, and I see that across my district, just like all the other members here have seen that, where there's people that work very, very, very hard, but just cannot make the money to buy health care. And that's why I'm so proud to stand here with my colleagues from both sides of the aisle to support this bipartisan common sense approach to protecting the American health care. For families across the country, this is not a partisan issue. This is making sure that they can afford a doctor's medicine, make sure they can get the prescriptions that they need, make sure that they get coverage next year. And this is why we're working together, because we all know what's at stake. Its premiums are set to rise. No ifs, no buts about it. We know that premiums are going to rise if we don't take the action. And I'm glad that we're working together. And I stand with my friends. Look, we got to make some reforms, and I stand and I'm ready to make reforms. But you know, you can't get the work done if you don't propose something. And as I would said, we are at least proposing something, and we're willing to sit down, and we've sat down with the Senate and the House, and you know, hopefully our leadership on both sides will look at what this bipartisan group is doing. So with that, I want to say thank you to my colleagues, and especially Josh and Jen. This time, it's my pleasure to introduce my good friend, Mike. Where are you, Mike? Laura again. Thank you again for your leadership also.
Thank you.
Thank you.
Thank you, Henry, and thank you to Josh and Jen for organizing this today. You know, it's very easy to vote no. It's very easy to say what you're against, and it's very easy to point the finger at the other side. It is a lot harder to do the work of legislating, and everybody here is committed to actually legislating on the issues that matter to the American people, on the issue of affordability, on the issue of addressing healthcare costs, housing costs, energy and fuel costs, and food and grocery costs. That is what the American people expect us to do. They expect us to work together in a bipartisan way to actually come up with solutions. And the reality is, if you want to make lasting change in this country, if you want to actually accomplish something that impacts the vast majority of Americans, it cannot be done without bipartisan support. So this group is coming together today to say to our leadership on both sides, enough. We have a responsibility before the end of the year to pass a bill that will address the issue of health care costs in this country. We can all sit here and go through the perils of our health care system. It is a disaster from start to finish. The question is, how do we deal with this in the immediate and the long term? The immediate requires passage of an extension on the enhanced premium tax credit for the Affordable Care Act. It is expiring at the end of this year. We are talking about whether or not the federal government is subsidizing a plan to the tune of 78% or 88%. But that difference means a lot to the 24 million people who are impacted by it. And so we need to address that by having a 2-year extension with reforms that will address some of the concerns that have been raised about these temporary tax credits that were put in place during COVID, while addressing some of the longer-term issues with healthcare, including the insurance companies. When you have an insurance company like United Healthcare owning primary care practice, that needs to be addressed. That is a fundamental problem. So we have to look at how we address the longer-term impacts of healthcare and how we actually reduce costs, increase access, and improve quality of care. But in the immediate, we are focused on getting a bill passed by the end of this year to ensure that Americans who are on the open exchange, who rely on these premium tax credits, do not see a health insurance spike. It requires all of us working together and our leadership focusing on getting a solution rather than a political win. That is what is critical. We need a solution, not a political win. And with that, I will introduce my colleague from New York, Josh Riley.
Good morning, everybody. Josh Riley, upstate New York. And where I come from, folks care a lot less about whether you're a Democrat or a Republican. What we care about is you have common sense and are you doing right by your neighbors. And that's what this is about. The question I get when I'm back home isn't the question that a bunch of folks here ask, who's up and who's down in Washington, who's scoring points, what's going to happen in the next election. Nobody at home cares about that stuff. Questions I'm getting are, how the hell am I supposed to afford the NICEAG bill, the Central Hudson bill? We just had 7 inches of snow at home. Kiddos need a new pair of boots. How am I going to afford that and still pay for all the groceries? And now you're telling me our health care premiums are going to spike because you folks in the swamp can't get together and keep the government open and keep the costs down? We're not going to let that happen and let these families face unaffordable health care costs. And I don't care whether it's Democrats or Republicans who are going to get it done. We've got to get it done. Health care should be a civil right in this country, not something that's bankrupting American families and driving corporate profits. And whoever's willing to come together and work together to get it done, I'm willing to work with them. So thank you all for being here. I appreciate it. And Kevin Kiley.
Thanks very much. Well, I think all of us here today are sending a very clear message, which is that doing nothing is not an option. Doing nothing is not an option. When you're talking about 22 million people, and these are independent contractors, freelancers, gig workers, Uber drivers, small business owners and their employees who are going to be very hard hit, who are suddenly going to have to pay thousands of dollars more for health care, doing nothing is not an option. You talk about affordability. There is perhaps no single question that has greater stakes for affordability in America in the coming year than doing something about the expiration of these tax credits. Now, I happen to be partial to the bill that Sam Ricardo and I have introduced that has 5 Republicans and 5 Democrats as co-sponsors. But the framework we're releasing today, the other proposals that are out there, there is a broad enough circle of consensus that we should be able to get this done by the end of the year. And let's be honest, this has not exactly been the finest hour for the U.S. House of Representatives. Over the last several months, the House has been missing in action in a lot of ways. At the decision of leadership, we were literally absent for the last 2 months. The House has not exactly been in the driver's seat when it comes to the issues that really matter to the country. This is an opportunity to change that. This is an opportunity for the House to lead, for the House to reassert itself, to once again become the people's House by actually serving the American people. Swazi.
I really wanted to come here today to praise Josh and Jen. This is incredibly effective what they've done to get so many people to sign up for this framework. And that's not an easy thing to do because the muscle memory of bipartisanship in this town has really atrophied. And to get this many people to say we want to do something in a bipartisan basis is a major accomplishment and something that we need to be encouraging more here in Washington, D.C. I just looked up one of my constituents in my district back in New York whose insurance now costs them $11,050 for a family of 4. They make $130,000 a year. Their insurance costs them $11,050. Their insurance will go up to $30,000 if this bill is allowed to expire. I mean, that's literally over $1,500 more per month for a family of 4 of a family making $130,000 a year. It's crazy. So I echo everything that all my colleagues have said before me, and I want to again thank all of my colleagues, Democrats and Republicans, who've worked together to get to this point, and I want to again praise Congressman Gottheimer and Congresswoman Kiggins. Thank you.
Thank you. Thanks. I know we have votes, so I guess we can.
Yes, thank you.
If anybody has any questions.
Yeah, thank you all for coming. No, votes have been called.
Okay,
so
votes been called.
I think everybody's
What has leadership been saying to both of your parties on this? I mean, you need support from leadership on this, don't
Can
you?
I ask a favor? Can you guys grab us right off the floor just so we can vote? Is that
Can
okay?
you come to the bottom of the steps so we can get it on camera?
Sure. Yeah, no problem. Is that okay? Right after we vote, we'll meet at the bottom of the steps. Is that okay?
Yeah, I mean,
Just-
we're supposed to take questions in here.
Go ahead. I'll take a question, but
What
I just don't want to do it by
has leadership
myself.
said about this to you?
We've been I can just speak from my side. We've been sharing, of course, sharing with leadership. And I think the biggest thing I've heard from my leadership is we got to find a solution. And as you know, Leader Jeffries has been very clear that he's open to bipartisan solutions. So, you know, I think
Is
it's
Schumer
been.
on board?
I have not spoken to Senator Schumer. I could just speak to my conversations with House leadership. Yeah. Anything else? Sorry, guys. I won't be able to answer your question. Sorry. We ran long, but we'll meet at the bottom of the steps. Is that okay? I'll talk to Jen. I'm sorry, guys.